Okay, why don't we get started? Okay. So I'm Bruce Lee. I'm the director of the Global Obesity Prevention Center. I wanted to thank all of you for coming to this talk. We do realize that it's 1 or 2 days after graduation, but I think that the speaker as well as the topic are so intriguing that it attracted all of you to come to watch the seminar. So thanks again. So I wanted to tell you a little story about our speaker. We were putting together a grant maybe about a year ago or so. It was a grant that was to build a simulation model. And we realized that we needed economic expertise. So we said, okay, who knows economics and obesity? And unanimously in the room, everyone said John Cawley. Basically because he is synonymous with economics and obesity. If you were talking about a world leader or a thought leader in terms of that area. So it's pretty much, our hope was that, okay, well, maybe John can join this proposal, and he did, which was fantastic, and we were able to utilize his expertise and his vast experience. So any of you who've been in the obesity arena or have read articles in the New York Times or major leading outlets have probably seen John's name because he's been extremely influential within the topic and within the area. And obesity, of course, has grown in terms of prominence. And we now have a global epidemic, and a lot of the big questions in obesity are economic. How are economics driving the obesity epidemic? How's the pricing of food, the pricing of drinks, and how are economic differences among different populations driving the obesity epidemic? And on the flip side, what's the economic impact of obesity throughout the world? So these are major questions, and we're so glad as a community and as a world that John has really taken on these topics and these major questions, and it'll be very important in terms of finding a solution to the obesity epidemic. Hopefully, ultimately, we can come to that solution. So a little bit on his background. He's a professor in the Department of Policy Analysis and Management and the Department of Economics at Cornell University. He received his PhD in economics at the University of Chicago, and then after spending some time at the University of Michigan, moved to Cornell University. I'm not going to list all of his honors and awards because there's too many to list here, but he's a member of NBER, National Bureau of Economics Research, and he's won numerous awards for his work. So rather than give you a laundry list of that, I don't want to cut too much into his time because he's going to be talking about a fascinating topic, and this is completely timely. I mean, anyone who's read a newspaper or read a magazine realizes that one of the big debates around obesity is what to do about taxing beverages as well as other types of foods that contain high amounts of sugar or energy dense or what have you. And so this is a major issue, so I don't want to cut into his time. But John, we're so happy to have you here.
Thanks, Bruce. Well, thanks very much for having me. I mean, this is a fantastic place to come as someone interested in obesity and health more generally. Just an absolutely amazing institution. It's been fantastic to meet and talk more with Bruce and his team, and to see others like David Bishai, who's now the president of the International Health Economics Association, of which I'm a proud member. And very happy, too, to see two distinguished alumni of the undergraduate program in my department, Matt Eisenberg and Lauren Nicholas. So, and nice to meet all of you as well. So like Bruce said, my main interests lie in the economics of obesity. And so that includes like economic contributors to obesity, so things like income, food prices, food advertising, and then economic consequences of obesity, so higher medical care costs, lower wages, lower probability of employment, job absenteeism, and then economic insights into treatment and prevention, whether that might be taxing energy-dense foods, offering financial rewards for weight loss, the new nationwide menu calorie labels on restaurant menus, seeing how that affects consumers' choices. So what I wanted to talk about today are two projects that I'm doing in this space of taxing energy-dense foods. So I just wanted to start off by, beginning with the really big picture, which is just why do we think this might be a good idea? Like, what's the rationale for this? And I think it's important to start there because you do see pushback among certain consumers feeling like the government's a nanny state if they're trying to influence my diet. So what is the case, actually, for government intervention to alter people's diets? I'll just list some of the more recent taxes that have been implemented, different approaches different cities, states, and countries have taken in this regard. But then the meat of the presentation will be a discussion of these two projects that I mentioned earlier. And so the first concerns this preliminary question, which is, after the government implements a tax on energy-dense foods, how much of that is passed on to consumers in the form of higher prices? And then the second project concerns, after whatever pass-through has occurred, how do consumers' food choices actually respond when we make non-nutritious food relatively more expensive than nutritious food? To start at that beginning and think about, like, why is this something that the government should be thinking about doing, or is this just overreach or paternalism or a nanny state? Part of the motivation has to be that the diets that we see, not just in Western developed countries, but also worldwide, tend to result in very high rates of chronic disease. So, for example, heart disease, which is the #1 cause of death in the United States, is linked to to poor diet. Cancer, right? Cancers of the colon, the kidney, larynx, esophagus, and so on, some of them are to a certain extent diet-related, and that's the #2 cause of death in the United States. And then, of course, there's diabetes, right? So very directly linked to diet. The prevalence of diabetes in the United States population is 11% among adults. Pre-diabetes is even higher. And as you know, there's two types of diabetes. There was what used to be called juvenile onset, or type 1, and then there's what used to be called adult onset, which is type 2. It's type 2 that's much more diet-related, and over 90% of the diabetes in the US is type 2. So this isn't being driven by, sort of genetics and juvenile diabetes. This is really diet-related. Diabetes is the #7 cause of death in the US. It's actually #1 in Mexico. I was down in Mexico for an obesity conference recently. It's the country that's got one of the highest rates of overweight in the world. It has the highest consumption of sugar-sweetened beverages in the world. And so diabetes is the #1 killer. And people there will die within a year of diagnosis. And then finally, of course, there's obesity itself. The prevalence among adults in the United States is now over 35%, and there's no evidence of it falling. And I just wanted to clarify again that this is not just an issue for the United States, it's not just an issue for economically developed countries, it's also an issue for economically developing countries as well. So this is a table of the risk factors for preventable death by national income. And so the upper left quadrant here, so that shows you the top 10 risk factors for preventable death in the world. And then this is the top 10 for low-income countries, middle-income countries, and then high-income countries. And this table is produced by the World Health Organization in its Global Health Risks Report. So if you look at high-income countries, it turns out that 5 out of the 10 preventable causes of death are diet-related. So high blood pressure, overweight and obesity, high blood glucose, high cholesterol, and then low fruit and vegetable intake. And that's 5, not even including physical inactivity. But among low-income countries, too, there's several diet-related preventable causes of death. So childhood underweight is the #1 preventable cause of death in those countries. So this reflects that dual burden of malnutrition, where coexisting are food insecurity, hunger, with obesity and poor diets. But #2 is high blood pressure. #5 is high blood glucose or diabetes. And then high cholesterol is #10. So this really is like a worldwide phenomenon, this problem of poor diets causing high rates of chronic disease. And then with respect to obesity, so this is a map produced by the World Health Organization last year, and it shows you as best they can compare the prevalences of obesity for adult women across different countries of the world. And so what's interesting is it's not just the United States that's in this highest category, the darkest color, of having a prevalence of adult female obesity that's over 30%. It's also a large swath of the Middle East. And it's funny because David Bishai was just mentioning before the talk of how high the prevalence of overweight and obesity are in Egypt. And I think in general, there isn't this full appreciation yet for just how high obesity rates are in that region. People, I think, tend to know about the United States, Mexico, and also, of course, about Pacific Island nations like Nauru, Tonga, Samoa, that have the highest rates of obesity in the world. Adult prevalence is over 60% compared to the 35% in the United States. But you can see, it's in every part of the world, this prevalence of high prevalence of obesity. So what exactly is it about these diets that contributes to these high rates of chronic disease and obesity. So sometimes the modern diet is referred to as the Western diet, which I think is not the best terminology, because sometimes the Western diet is compared to the Mediterranean diet, but the Mediterranean's a Western part of the world as well. But sometimes people colloquially will use that term Western diet, and what they mean is a problem of too much saturated fat. So, we'd have healthier hearts if instead of using so much saturated fat, we used more unsaturated fat, whether it's polyunsaturated or monounsaturated, MUFA or PUFA. Trans fats historically have been a problem because trans fats pack very sort of efficiently in our arteries and can cause heart attacks. But trans fats are not likely to be a major problem in the future. The US FDA is basically, banning them for use in the US. The EU has taken similar steps. So trans fats happily will not be part of our future problem. But high levels of cholesterol, added sugars, added salt, and refined instead of whole grains. And so what we're sort of lacking are whole grains, fresh fruits and vegetables, and more generally fiber. So what I think is one really interesting question is, why is this any of our business? Right? So there's people all over the world who have poor diets. Maybe they're also physically inactive. They have high rates of obesity, cardiovascular disease, cancer. If that's what people want to do, are we just being paternalistic? Are we being a nanny state if we try and change people's behavior? So there's lots of different perspectives on this, but I tend to use the economic perspective. And one nice thing about the discipline of economics is it has these really specific criteria for when it makes sense from the economic point of view for a government to intervene into a market. And so the economic perspective is that if free markets are working perfectly, which means no externalities, in other words, like my decisions don't impose any costs on you, perfect information, sort of no frictions like search costs and things like that, then if you have a perfectly functioning free market, there's really no way for the government to intervene and make things better. All it can do is reduce social welfare, make things worse. But that's absolutely not the case in the markets for food and markets related to physical activity and obesity. There are very clear externalities. In other words, if I decide to be physically inactive and to have a poor diet and to be obese, I don't bear all those costs out of my own pocket. Those are shared by everybody. And so, for example, if I'm on my employer's health insurance and you're also on the Cornell health insurance, you will be paying some of the costs of my risky behaviors, because when I rack up higher healthcare costs, they're not just paid by me, they're paid by the entire health insurance pool, because the premiums I pay are not based on whether I have a good diet, what my weight is, whether I'm physically active. So everybody in that health insurance pool bears the costs of these behaviors. So that's a perfect example of a negative externality. Likewise, if someone's on Medicaid, right, so health insurance for low-income Americans, that's funded with tax dollars. So the tax burden on everybody else rises when more people on Medicaid are consuming poor diets, being physically inactive, and being obese. Same thing with Medicare, which is funded by a wage tax. All of us are paying higher wage costs to pay the costs of treating obesity-related illnesses, chronic diseases caused by a poor diet. So from an economic perspective, there's a very clear economic rationale for intervening in markets to change people's diets. And so the economist A.C. Pigou argued that in a case where you have these negative externalities, the government should impose a tax that's equal to the amount of these external costs, and basically confront people with the full costs and consequences of their actions, and then let them make up their mind as to how they want to behave, because then they're not, spilling over costs onto anyone else. So this would be, exactly the rationale for having taxes on energy-dense, non-nutritious food. And just to clarify, what I mean by energy-dense is just high calorie. So we don't know exactly how high these external costs are, but we know that they must be really large because our health insurance premiums aren't based on our diets or physical activity, and in general, the costs of these diet-related chronic diseases are really expensive. So it's estimated that cardiovascular disease, the US spends $444 billion a year treating it. It's estimated that the US spends $315.8 billion treating obesity-related illnesses, $263.8 billion treating cancer, $116 billion a year treating diabetes. Now, some of these are double counting, like the obesity number includes cardiovascular disease, cancer, and diabetes caused by obesity. So these shouldn't be just simply summed, but it just gives you a sense of these are enormous costs, and most of them are external costs. They're being paid for by the entire health insurance pool, by Medicare, by Medicaid, and so there's clearly really big externalities here. So what I just described to you is the neoclassical economics rationale. So neoclassical refers to sort of, the economics exclusively from a generation ago. But there's also a more recent behavioral economics rationale. So behavioral economics relative to neoclassical economics incorporates more findings from psychology to better understand the ways in which people's behavior deviates from being perfectly rational. And so behavioral economists recognize an additional rationale for these taxes, which is to help people help themselves. In other words, people might want to eat healthy, be physically active, be a healthy weight, but they have what are called time inconsistent preferences, meaning that if you ask me, do I want next year's me to weigh 5 pounds less and be, running 5Ks on a regular basis, I might say, yeah, that sounds great. Like, let's make future me do that. But when it comes time for today me to go to the gym and eat less, I never want to do it because I want immediate gratification. So that's an example of time inconsistent preferences where I want the best for future me, but today me doesn't want to pay any of the price of that. And so if somebody has those kinds of preferences, you'll see them doing things like announcing another, New Year's resolution to lose weight that they very quickly, quit, or going on diets and quickly falling off them. So behavioral economics argue that in a situation like that, a person, even if there's no external cost, a person might want the government to make it easier for them to do what's in their long-run interest. So this would be a smoker saying, I want to quit, but nothing works. In a way, I wish the government would make cigarettes incredibly expensive or take cigarettes off the market, and then I couldn't smoke, and that would help me, do what I want to do in the long run. So you could imagine that too being part of the rationale, but I'm a little wary of that because it's kind of a slippery slope to paternalism. It's kind of too easy to assume like these people who I disagree with just don't know what they're doing and they need me to tell them like how they should live their lives. So it's a little risky. But based on those rationales and other rationales, there's been many calls for taxes on energy-dense foods. So just in the last year, the World Health Organization, the British Medical Association, the U.S. Dietary Guidelines Advisory Committee have all called for taxes on energy-dense foods. Institute of Medicine has done so in the past. The International Obesity Task Force has encouraged all EU member nations to adopt such taxes. And then there's been numerous editorials in medical journals, including ones in the New England Journal of Medicine, American Journal of Public Health, and so on. And policymakers have really responded. There's actually been a lot of action in terms of these types of taxes. So in the US, currently 39 states tax soft drinks that are sold in vending machines at an average rate of 4%, and 34 states tax sugar-sweetened beverages sold in grocery stores at an average rate of 3.43%. But these were not enacted for public health reasons. They were enacted for revenue generation reasons. And so these taxes actually don't differentiate between diet and regular. So the tax on a Diet Coke is the same as the tax on a Coke. So it's kind of a different animal than I think what people are suggesting more recently. Berkeley, California really stands out. So they're the first city in the United States to adopt a tax on sugar-sweetened beverages expressly for public health reasons, not for revenue generation reasons. And that's the tax that I'll be talking about in just a bit because that's where we study the pass-through of the tax. Denmark had a really interesting experience about 5 years ago where they passed a tax on foods that were very high in saturated fat and also taxes on sugar and sugar-sweetened beverages. But they actually repealed it 2 years later because they found that they had a problem with cross-border shopping. So Denmark's a small country, it's right attached to Germany, and so it's easy for people to drive across the border, buy their groceries with high saturated fat content, and drive back. And so it was actually sort of the grocers of Denmark that lobbied to have the tax repealed because they were just losing business to northern Germany. Finland, France, Hungary, Ireland, Mexico has implemented very large taxes on not just sugar-sweetened beverages, but also snacks, 8% tax on snacks, for example. And then the UK is talking about implementing a soda tax next year, although that's pitched as being for revenue generation reasons. As you may have heard, Philadelphia is also considering a sugar-sweetened beverage tax, but that's really being taught in terms of revenue generation, not in terms of public health. So this is clearly sort of like a hot area. A lot of countries are trying this this fall. Besides Philadelphia, it'll also be on the ballot in San Francisco, certain other cities in California. It might be on the ballot in Chicago and other places. So we want to just better understand what are the consequences of enacting these sorts of taxes on energy-dense foods. So the two important questions that I want to just briefly talk about are, to what extent are such taxes passed through to consumers in the form of higher prices? And then second, to what extent do consumers buy or eat less energy-dense food when the price that they pay at the supermarket goes up? So I'll start with the first project, which concerns the pass-through of the tax in Berkeley on sugar-sweetened beverages. And this is work that's joint with David Friswald of the University of Iowa. So in thinking about the impact of such a tax, like on sugar-sweetened beverages, on prices, I think non-economists just commonly assume that, well, if you tax the store pays it. If you tax the consumer pays it, because that's who it's levied on, right? But it's a sort of long-standing finding in the field of economics known as public finance that who actually pays the tax depends on what's called the relative elasticities of supply and demand. So in other words, if what you're selling is a necessity, some life-saving drug, then a firm could pass on a tax fully to consumers because it's a necessity of life. They have very inelastic demand. It doesn't vary with price. The whole tax can be passed on to consumers. But on the other hand, if you're selling something that's discretionary, there's other close substitutes available that won't be taxed, then demand is going to be very elastic. It's going to change a lot with price. And in that case, a firm may not really be able to pass on much of it to consumers. So there have been several studies of the pass-through of taxes on sugar-sweetened beverages in particular. So there's been studies of the ones in France, in Denmark, and now in Mexico. And interestingly, none of them are published. So the Berardi paper, which studies the implementation in France, they have data at the level of supermarket. And what they find is that by the fourth month of the tax was fully passed on to consumers. So all of the tax was translated into a higher retail price to consumers. Bergman and Hansen studied the tax in Denmark, and they have data at the level of store chain. One observation would be an entire supermarket chain. And what they find is that the tax is actually overshifted, meaning that the price went up by more than the amount of the tax, which would be true if prices were sticky, for example. Firms are hesitant to raise their prices until there's a really good excuse or other potential reasons. And then Jeff Grogger studied the Mexican tax on sugar-sweetened beverages, which is pretty recent. And he got data from the Mexican government that's used to calculate the CPI, the Consumer Price Index. So he's just got city-level observations. And what he finds is, again, that the tax was overshifted. Prices actually went up by more than the tax. A 9% tax raised the price of sugar-sweetened beverages by 12%. So one challenge for all three of these studies is that in no case do any of them have a control group. They just interpret all the change in price over time within that country as being due to the tax. And that's not ideal because, as we know, there's inflation over time, prices tend to drift up, and there could be shocks to prices. So for example, if the price of oil goes up, the price of delivering sugar-sweetened beverages goes up, and that gets passed on to consumers, you wouldn't want to include that as part of the pass-through of the tax. So what we're studying is the first of these taxes implemented in the US, and that's the tax that was enacted in Berkeley. So the story behind this is sort of interesting. It wasn't that the Berkeley City Council passed it, it was put on the ballot and voters decided whether they wanted to have a 1 cent per ounce tax on sugar-sweetened beverages. So this includes soda, energy drinks, sweetened tea, but does not include diet drinks. It doesn't include, obviously, water. It doesn't include 100% juice. So this is something we could debate about, right? Is do you really want to exempt sugar water like apple juice when you're taxing, Coke and Pepsi? It excludes milk products. So a Starbucks drink that's got milk and coffee in it is exempt. Infant formula, yes, that should be exempt. Alcoholic beverages, I don't see the rationale for excluding those, but they're exempt as well. So interestingly, the way this was pitched to consumers was, this will be good. It'll lower consumption of sugar-sweetened beverages, and that'll improve the health of our city. But they also said, but don't worry, it's not a tax on consumers, it's a tax on distributors. And so they're kind of trying to have it both ways by making it sound like, well, this will be fully passed on, and that'll result in less consumption. But don't worry, we're not taxing you, we're taxing people upstream. So the distributors are the companies that have the trucks and drive the beverages and sell them to the retailers. So the tax isn't on the stores, it's on the step before that. And the proponents of the tax argued that this would be fully passed on. When you look at their sort of predictions of how this would affect things in Berkeley, they were fully assuming that the full 1 cent per ounce would be passed on to consumers in the form of higher prices. So one other interesting aspect of this story is that the ballot referendum, the public referendum took place in early November of 2014, and the law said that the tax would take effect on January 1st of 2015, less than 2 months later. And so in January, there was just this chaos where stores were completely confused, are we supposed to be collecting this tax? You haven't told us who to pay yet. And so then later in January, maybe it was even early February, they came out and said, okay, actually, we're not ready. We just didn't have time since this law passed, so we won't start collecting this tax until March. So interesting where there was confusion on several parts as to whether the tax was actually being collected in January or so. So the data that we got, it's just collected by hand. So we sent research assistants to every store in Berkeley, as well as in a large number of stores in a control community. So this is Marcus and this is Natalie, like on the ground in Berkeley. They had sheets where they would go in and they would record the prices both before and after the tax took effect. So after the law passed in November, David and I just brainstormed, like, how do we collect pre-tax data when we've got less than 2 months to do this? We got these students out there. How do we know where the stores are? Well, there's a database called Reference USA, and it gives you the address of every store, like in America, basically. And it's updated monthly. So we send them to every one of those stores. We also collected data from a sample in San Francisco, which is our control community. And I'll explain in a little bit why we think that's a reasonable control community. So we collected data for the products that were going to be taxed. So Coke, Pepsi, Mountain Dew, Gatorade, and Red Bull. Collected data for some things that were exempt, Diet Coke, Diet Pepsi, and Dasani water. So we wanted to make sure that we had exactly the same items. So we did specify like 20-ounce bottle of Dasani water because you don't want them writing down the price of a different bottle of water in every store, which might have different prices. The pre-tax data collection took place in late December of 2014, and the post-tax data collection in late May, early June. So we also collected data in January of 2015, but it was in the midst of that we realized, like, this is just complete chaos. No one knows if this tax is going to be collected or not. So we did a whole round of data collection we ended up throwing out because it wasn't clear if it was really post-tax or pre-tax. So we go with the unambiguously pre-tax and post-tax dates shown there. So one nice thing is, in addition to getting these different branded items, the Coke, Pepsi, Mountain Dew, and so on, we also collected data on different sizes. So the 20-ounce bottle, which is the standard individual serving, a 2-liter bottle, which would probably be something you get for home, and then a 12-pack of 12-ounce cans, again, something that people are probably taking home. So we can see if the pass-through differs by size. So as I mentioned before, a challenge to accurately estimating the pass-through of a tax is the fact that there's inflation over time. There can be these like idiosyncratic shocks, like I said about, the price of gas could change and that might change the price of soda, or maybe, a distributor goes out of business and that changes the prices that other distributors charge. So the way that we deal with those idiosyncratic shocks is to estimate a difference in differences model. And so we've got our treatment community of Berkeley and our control community of San Francisco that did not implement a tax, but they're near each other, so they're served by, similar distributors. And with this difference in difference model, what we measure is the change over time in the price of a taxed item in Berkeley relative to the change over time in the price of the exact same item in the nearby community that didn't get the tax, which is San Francisco. So we estimate these models separately for brand, Coke, Pepsi, Mountain Dew, and by size, 20-ounce, 2-liter, and case of cans. The main outcome that we focus on is the price per ounce, because the tax was 1 cent per ounce, so the interpretation of these coefficients is actually really convenient. So if the coefficient's 1, it means 100% of the tax was passed on to consumers. To the extent it's less than 1, it's telling you, or more than 1, it's telling you the percentage of the tax that was passed on. So we control for store fixed effects, meaning that, to the extent that one store has different clientele than others, we're controlling for that. We got the data from the exact same stores, both before and after. We control for things like day of the week in case there's differences in sales. And we cluster the standard errors by store. So the key coefficient that we're focusing on is this beta DD. That's our difference in differences estimate, because it picks up what's the effect on stores that are treated by the tax after the tax is implemented relative to the prices of the same items in the control community. So in the paper, we examined different counterfactuals, but the one that I'll focus on today is just Berkeley, the treated store, compared to San Francisco, the control, Berkeley's treated community, relative to San Francisco, the control community. And so the assumption is that in the absence of this tax, the trends in the prices of these items would be the same in Berkeley as they were in San Francisco. And so one reason that we think San Francisco is a very good control is the fact that it's nearby, but not adjacent, so there wouldn't be any kind of spillover to them. It's politically similar. These are both sort of liberal, well-educated communities. But a really nice feature is that San Francisco also had on the ballot at the exact same time a similar measure that was defeated. But it was defeated with majority support. So it turns out that the key difference was that San Francisco said that they were going to earmark that tax money for certain projects. And when a tax is going to be earmarked, it has to get a supermajority to pass. Whereas if you don't earmark the money, you only need 50% to pass. So majority of people in San Francisco wanted this tax and voted for it, but they didn't get it. So most of the time in these types of studies, you worry about policy endogeneity. Like, can I really compare an area that has the law to the area that doesn't, because maybe there's a really good reason that one area has the law and one doesn't, like political differences or differences in markets. But this is a case where both communities wanted it, but only one got it. So this is just sort of the raw data, so you can just kind of eyeball what the difference in differences estimate is going to look like. So this is a 20-ounce bottle of Coke. I'll just use that as an example product. So this shows you the average price per ounce in Berkeley before the tax and after the tax. And so you can see that the price per ounce does go up. Like before the tax, it's a little under 9 cents per ounce. After the tax, it's more than that. But the prices did not rise by that full 1 cent per ounce of the tax. Right? So just from looking at the unconditional patterns, it looks like a partial pass-through. What happened in San Francisco for this same item, the 20-ounce bottle of Coke, both before and after the tax, the price per ounce is basically identical. So in this case, it looks like there weren't any shocks going on in the Bay Area that we needed to worry about for this product. There was no way to know that in advance, but it looks like there isn't based on that figure. Down here is the same exercise, but for a 20-ounce bottle of Pepsi. And so again, you can see that the price per ounce rises in Berkeley before and after the tax, but by less than 1 cent per ounce. And in San Francisco, you can see the price per ounce rose slightly. So this is the reason to do the difference in differences model, because you do want to subtract out this part of the increase in price that's not due to the tax, that's due to inflation or other kind of shocks. But the quick takeaway from this visual difference in differences is that pass-through was positive. Some of this tax got passed on, but it's not full. It's not 100%. So here are results of the difference in differences model. So for the sake of convenience, I'm just showing you those beta DDs, the key parameter that we care about. And so each one of these cells is showing you the results from a different regression. So we estimate models for Coke, for Pepsi, for Mountain Dew, and for Gatorade, and then for all products pooled. And then we also estimate them for the 20-ounce size, 2-liter size, 12-pack of 12-ounce cans, and then all sizes pooled. So for Coke, for example, when we look at what the difference in differences estimate of the pass-through is for a 20-ounce bottle of Coke, the pass-through was 0.411 cents per ounce. Or in other words, 41.1% of that tax was passed on to consumers in the form of higher prices for a 20-ounce Coke. For a 2-liter of Coke, the pass-through is 33.8%. For a 12-pack of cans, it was only 13.7%, which is not statistically significant. And then for all sizes of Coke pooled, the pass-through was 38.6%. So one other thing that's important to point out is not just that the pass-through was less than 50%, but the fact that we can rule out that it was 100%. So in these square brackets here are shown the 95% confidence interval of the estimate. And so you can see in every case, the high end of the 95% confidence interval is less than 1, which means that we can rule out that it was fully passed on. It's not just our best estimate that it was less than 1, but we can rule it out with 95% confidence that it was 1. So looking at Pepsi, the pass-through was somewhat similar. 95.8% pass-through for a 20-ounce bottle, 45.6% for a 2-liter, 32.3% for a 12-pack of cans, and this is statistically significant, whereas that for Coke wasn't. And across all sizes of Coke, the pass-through is 41.8%. So just to get down to, so then we start pooling across brands. So we pool Coke, Pepsi, Mountain Dew, and Gatorade, and we look at the pass-through for a given size for all brands combined. And for 20-ounce bottles, the pass-through is 45%, for 2 liters, 43.6%, for cases, 33%, and across all brands, all sizes, it's 43.1%. So this is actually our sort of bottom line estimate because it's based on all these brands, all these sizes. So again, the bottom line is pass-through was not only not 1, it was less than half. And again, we can rule out within these 95% confidence intervals that it was 1. This is just a graphical depiction of the same results. This is Coke. The white bars are Coke. The diagonal bars are Pepsi, shaded as all brands. The number tells you the point estimate, and the lines, the vertical lines, are the 95% confidence intervals. So in most cases, the 95% confidence intervals are greater than 0. So there was a significantly positive pass-through, but in no case are any of these confidence intervals including 1 or even 80%. So one nice thing about collecting these data ourselves, like at the store level, is that we can look really granularly at what's going on. And so one interesting question that came up is cross-border shopping a potential issue here, right? So I talked before about how in Denmark, people were driving to northern Germany to stock up on saturated fat products. it would be a lot easier to cross-border shop from Berkeley. Berkeley is a very small place. It's only 10 square miles. So every place is relatively close to the border. And when we look at what's the average distance from a store in Berkeley to a store outside of Berkeley, the average distance is 1.03 miles, and no store in Berkeley is more than 1.4 miles away from a store that can sell the same item without paying the tax on sugar-sweetened beverages, a store outside of Berkeley. So given that, we just wanted to look and see, does it look like the extent of pass-through depends on how far you are from the border, right? So maybe a store right on the border basically can't pass through any of it, and maybe stores closer to the interior can pass through at least some of it. So this outline is showing you the borders of Berkeley, California, and the little dark dots are showing you the stores outside of Berkeley that obviously wouldn't have taxed sugar-sweetened beverages. Now, there's no stores at all out here because this is a park, sort of a nature preserve, and there's none here because that's the ocean. And so the green dots mean that it's a store in Berkeley where the price before and after the tax went up by a cent or more. The yellow dot means that the price before and after the tax went up by some amount, but by less than 1 cent. And the red dot means that the price did not go up at all. It either stayed the same or actually fell. So this isn't really the difference in differences estimates because it's not subtracting out the change in San Francisco. It's just like a single difference, a single change. But something that's interesting is you can see that there's stores of different colors very close to each other. So there's stores on the same street that pass through none of the tax, some of the tax, and all of the tax. And there isn't a clear pattern of stores right on the border passing through none of it, and the stores furthest from the border passing along all of it. So another way that we can test this more formally is to re-estimate that regression model, but add a new term where we interact that difference in differences with the distance to the nearest store outside of Berkeley. And so what we find when we do this is for 20-ounce bottles, this interaction isn't statistically significant, meaning that the pass-through doesn't differ with distance to the border when you're talking about a single serving 20-ounce bottle. But when we look at larger sizes, so 2-liter bottles or cases of cans, the pass-through rates are higher the further they are from the border. And so our interpretation of this is that when it comes to getting a single drink of Coke, people aren't willing to cross a border to do that, like to buy a single 20-ounce bottle of Coke. You're not going to walk an extra mile. But when it comes to a weekend shopping run and you're buying 2-liter bottles, you're buying cases of cans, that people are willing to do it. And as a result, stores can pass on more of the tax on the 20-ounce bottles than they can on these bigger servings. And that depends on your distance as well. So stores within, sort of further from rival stores pass on more of the tax on these bigger sizes than stores closer to the border. So one nice thing is we can compare these results to the results found in a completely independent study that was also looking at the pass-through of the Berkeley sugar-sweetened beverage tax. So this is from a group at the University of California at Berkeley. It was easier for them to collect their store data. They sampled stores. They pretty much sampled just the stores in low SES neighborhoods, and then they supplemented it with data from supermarkets. So they have a different sample of stores than we do. In some cases, the prices that they include in the pre-tax period were collected in January, which is problematic because there was that confusion about whether the tax was actually being collected. They pretty much only collected data for one size, 20-ounce bottles, but when a 20-ounce bottle wasn't available, they'd take another size. They used not just San Francisco, but also Oakland as a control, and they estimate a somewhat different regression model, so they don't have store fixed effects or controls for product size or day of the week. But when we compare our results, despite the differences in model, despite the differences in sample, the results are actually pretty similar. So their model that's closest to ours, the difference in difference model comparing Berkeley to San Francisco and Oakland, they estimate 47% pass-through for all SSBs combined with a confidence interval of 25% to 69%. So they also rule out full pass-through of the tax with a different sample and a different model. So we take this to be, give us even more confidence that the pass-through was not 100% or near 100% in Berkeley. And there's actually added confirmation of this. So there were newspaper stories running in May and June of 2015 where journalists were going to these stores in Berkeley and finding that the tax wasn't being passed on to consumers. So this is one headline: if Berkeley shoppers don't have to pay the soda tax, does it really exist? And this was running at the end of May of 2015. So what we're finding and what the other researchers are finding really is consistent with what journalists are picking up on. So in conclusion, for this study, we find that less than half of the tax was passed on to consumers in the form of higher prices, just 43.1% when we pool all the brands and all the sizes. Those 95% confidence intervals rule out full pass-through of the tax. And there's this interesting heterogeneity in the pass-through. So as I mentioned, we find that, as you saw in that map of colored dots, about half the stores don't pass on any of the tax at all, and about a quarter seem to pass on all of it. And then it also seems to vary with distance to rival stores that don't have to tax sugar-sweetened beverages. For the higher, larger sizes, the 2 liters and the case of cans, pass-through is higher the further they are from rival stores, which isn't true for 20-ounce single servings. So I think a really interesting question is, well, why wasn't the pass-through higher? So we think part of the story is, in fact, this cross-border shopping, given what we find the difference from to rival stores, and given the fact of Denmark's experience in this regard. There's other published studies that find cross-border shopping in response to food taxes in the District of Columbia and the state of West Virginia. It's also possible that for whatever reason, the Berkeley shoppers have very elastic demand for soda pop. Like maybe it's very much an item they don't feel like they have to have, so they're very price sensitive, and so stores feel like they can't pass this on. Now, some have argued that maybe it's the case that Berkeley's still adjusting prices, but previous studies have found that pass-through is complete within a quarter or even a month. I mentioned before that in France, they found that by the 4th month, the tax was fully passed through. And even in May, journalists are still reporting that May of last year that the pass-through was incomplete or non-existent. So we don't think it's just a story of the pass-through will happen in some future time. It really looks like it's just pass-through is simply low. Okay, so that wraps up the first part of what I wanted to share, the work on the pass-through of taxes on sugar-sweetened beverages. And now there's this second stage of the question, which is, okay, however much of the tax is passed on to consumers, basically how sensitive are consumers to prices when it comes to purchases of energy-dense products? So this is a project that I've been working on with 3 colleagues at Cornell, Brian Wansink, David Justin, and Drew Hanks, and we're thankful to the NIH for their funding of this project. So the specific research questions that we have are consumers' food purchases responsive to non-nutritious food being made 10% more expensive than nutritious food? So if we change relative prices, do consumers respond? Second of all, does a consumer's responsiveness depend on whether we tell them that it's a tax on non-nutritious food or a subsidy for nutritious food or both? And then do those answers differ by a consumer's income or education? And so our preliminary results are that the relative price change, even a 10% price change, making non-nutritious food 10% more expensive than nutritious food, didn't affect, for the sample as a whole, their purchases. Overall, for the entire sample, we find that it doesn't matter how we frame it, whether we tell them it's a tax on non-nutritious food or a subsidy for nutritious food. But where we do see some interesting differences are by income. So for low-income people that we tell we're giving them a subsidy for nutritious food, they buy more of everything. So not just of the relatively cheap nutritious food, they buy more non-nutritious food as well. So, what do we know from the previous literature about whether food taxes change behavior? Well, if you look at those, taxes that exist in the U.S. in states on sugar-sweetened beverages and snacks, those taxes are so small that basically researchers haven't been able to detect any effect of them. So it could just mean they're too small. If we had bigger ones, people would be responsive, or it could just mean that people's demand is relatively inelastic. Those taxes I mentioned in other countries, those are hard to evaluate because they're at the national level, and it's really hard to have a good control group for them. So it argues that like a randomized controlled experiment is really a good way to answer this question. Now, some people have used scanner data, like from Nielsen and other sources, which give you information about people's purchases over long periods of time at different stores. And they just, use the existing variation, the fact that sometimes a 2 liter of Coke's 99 cents, sometimes it's $1.49, and they use that naturally occurring variation to try and estimate how responsive people are to changes in price. What these studies tend to find is that people are only moderately responsive to changes in price, and that people tend to substitute. And so if you make one energy-dense item more expensive, people will substitute towards another energy-dense item that didn't go up in price. And the problem with these kinds of studies is just like we don't know where that variation in price is coming from. It's not experimentally generated. And so the risk is that when prices spike, it's because demand also spiked. And that's not a good way to measure the effect of price on demand when the price changes are being caused by demand. So there's also information from other field experiments. The University of Minnesota conducted numerous studies like this in the 1990s that are really interesting. But in many cases, they combined price changes with other interventions. So they didn't just make salads cheaper, they also put up signs encouraging people to try the salad or notifying people that the salads had been dropped in price or were being subsidized. But when these University of Minnesota researchers made really big changes in price, they did find that people responded. So for example, when they gave 50% subsidies for fruits and salads, they could triple in the short term what the sales of those products were. But when they took away the subsidies, sales dropped back to normal. So they weren't able to create like durable good habits. Brian Elbel at NYU did a really interesting study where he set up his own store in a hospital in New York City and just stocked it with the items he wanted to stock. And he imposed a 30% tax on unhealthy foods to see how that would affect people's purchases. But again, it wasn't simply a price intervention. They were also, sort of drawing people's attention to comparisons. They were juxtaposing healthy and unhealthy versions of certain foods. But what they find is that they could increase the probability of people choosing the healthier version by 11 percentage points. And then one other interesting study that was done recently is by the USDA. So they did what was called the Healthy Incentives Pilot for SNAP recipients. And what they did is they gave a 30-cent rebate to your EBT card, your electronic benefit transfer card, for SNAP, for food stamps, for every $1 that you spent on fresh fruits and vegetables. So it wasn't like a lower price immediately. It was like a credit that you got later on your card. But what they estimate the effect was that they raised fresh fruit and vegetable consumption of the treatment group by about 1/5 of a cup a day, which is about 2 to 3 tablespoons. So what we want to contribute to this area is we're conducting a field experiment to estimate the impact on consumer purchases of us making non-nutritious food 10% more expensive than nutritious food. And so if you remember, like the average taxes on sugar-sweetened beverages, for example, in US states currently average 4%, and the taxes on snacks average about 3%. So we're talking about a tax that we're experimentally creating that's about 2.5 times the biggest one that exists in states today. So another advantage is that we're doing this in a real grocery store. We're not setting up a fake store. We're not making this hypothetical where people are asked to make choices online that they'll never have to actually complete. These are real shoppers in a real store. It's where they already shop. And we don't do any other interventions at the same time. There's just the price treatment. There's no extra signs. There's no other ways that we're attempting to influence people. Another contribution is that we're focusing on the ability to affect consumers by how the price change is framed. So does it matter whether we tell them it's a tax on non-nutritious food or a subsidy for nutritious food? And then finally, we examine differences by education and income. And regarding this issue of framing, so the reason we think the frame might matter is based on the work of Kahneman and Tversky. And so Kahneman and Tversky, through their prospect theory, argue that when you talk about gains and losses to people, they interpret them with respect to some reference point. And so they talked about, in their seminal work, a survey they conducted where they told people that there was a really bad disease hitting the US and what was their willingness to adopt this risky medical intervention that might help a lot of people, could also harm people. And they found that when you describe the exact same risk trade-off in terms of the number of lives that could be saved, people were more supportive of taking the risk than when you describe the exact same probabilities but talked about the number of people who were going to die. And so it's the same trade-off, but the reference seems to matter. And so another sort of funny example of this had behavioral economists as the subjects. And so a behavioral economics conference randomly sent emails, and they told half of the people, if you register for the conference late, you'll pay a penalty of $50. And they told the other half, if you register early, you'll get a discount of $50. So the trade-off is exactly the same. And what they found is that the graduate students were more responsive to the penalty than to the reward, but the faculty saw through this ruse and were not affected. So it's just funny to think behavioral economists also are subject to these same phenomena. So in our field experiment, we recruited 239 shoppers at 2 grocery stores of the same chain in the Northeast US. And we went at different times of day, different days, so you're not just getting like stay-at-home moms, you're getting a broad group of people. To be included in the study, you had to have children in your household, and you had to do at least 75% of your shopping at these stores, because otherwise if we're signing people up who don't shop at the stores, we're never going to observe any transactions. And this person had to do most of the shopping for their family. So we ran into a funny situation where 16 households had 2 participants each. They both insisted we each do exactly 50% of the shopping. You have to let us both participate in the study. And so we did, and we just aggregated them up to the household level. We emailed people a survey so we could find out more about them and their households and their shopping patterns. We only lost 1 household to attrition during this 8-month study. And so this was basically one of the most popular studies ever conducted by me and my colleagues because were giving people discounts to buy the stuff they want to buy. And so people were calling up and saying, I have friends who want to participate. Can they get the discounts too? And they were told no. But the way that this worked is, unfortunately, the store wouldn't let us go in and change prices willy-nilly and affect all their sales and all their consumers. And so the way that we operationalized this is that everybody in the study got a scanner card that had their name and their face on the card. And they would scan that before they bought anything so that we would know everything they're buying. And then based on what they bought, they would receive, electronically added to a debit card, the net of their subsidies and taxes. And so we explained to people what's subsidized and what's taxed. Every week, people got an email explaining again, like, this is how you can tell, what's subsidized and what's taxed. Here's how much you got on your card. So unfortunately, we don't have that extra sort of salience of people seeing right on the supermarket shelf the higher price. But with these reminders, people certainly seemed aware of, the discounts and taxes they were paying. So in a study like this, there's this really interesting question of, okay, if you want to divide like all foods into a category you want to incentivize and a category you want to discourage, like how do you decide what foods fall into what category? Like I mentioned before, apple juice, should that be subsidized? Should it not be? And so we took a very convenient approach to this, which is we use a system already in place in the supermarket. So this is what's called a supermarket shelf label nutrition guidance system, and it's called Guiding Stars. So below every item on the supermarket shelf is this sticker, which you're used to seeing everywhere, but the novelty is this part on the right where you can see a running man with 1, 2, or 3 stars. The man can also have no stars, and the larger the number of stars, the more nutritious the item is. So the way that people are told to interpret this is 0 stars means it doesn't meet our nutritional criteria. So it's a gentle way of saying it's not nutritious. 1 star is good nutritional value, 2 is better, 3 is best. Now, how is the number of stars determined? Pretty much the way you'd expect. The more vitamins, minerals, and fiber raise the score, and more saturated fat, trans fat, cholesterol, salt, and sugar lower the score. So again, this is not part of our intervention in the sense we didn't introduce this. This was in place in this supermarket for years. And educational materials about this program are throughout the store. So people already knew how this system worked. It was already in place. Virtually all the food items in the store are rated as 0, 1, 2, or 3 stars. More than 60,000 items are rated. So the few that aren't rated are either new, like it's literally like a new product to market, and they just haven't gotten around to determining the number of stars yet. Seasonal items just aren't ever rated. So right around Easter, like those marshmallow peeps, they're not going to bother rating them. They're only there a few weeks. And then things with no calories or nutrients are not rated. So things like dried tea, dried coffee, but also bottled water, which that last one is pretty interesting to us. So we'll talk about that category separately. We'll call that unrated. So for the sake of convenience, so that people could easily understand like what's nutritious and what isn't, we said that anything that gets 0 stars is less nutritious and is going to be potentially taxed. And if it has any stars, then it's going to be considered to be nutritious and potentially subsidized. So before we impose any treatment, we first collect data on people during a baseline period. So during the baseline period, people get 10% off any rated food item, whether it gets 0 stars, 1, 2, or 3. And the purpose of this is so we can see what people buy normally before we start manipulating relative prices. So that was 1 to 2 months, 4 to 8 weeks. So then for 25 weeks, that's the treatment period. And a household at the beginning of that period is assigned to either stay in the control, where the baseline treatment, where the baseline situation continues to prevail, where you just get 10% off everything, there's no change in relative prices, or you're in the treatment group, and we impose this 10% difference in the price of non-nutritious to nutritious food. We make non-nutritious food 10% more expensive. And so just to clarify, the reason that we give people in the control group and people during baseline 10% off everything is so they do their shopping here and we can observe it. Like if we just told people, out of the goodness of your heart, please, use this scanner card and let us know what you bought, like people would just buy stuff at all sorts of stores. We'd never observe what they were buying. So this way, it always is in their interest to buy the food at this supermarket so we can see what happens to their shopping basket. So the treatment group is actually divided further into 3 treatment groups that differ in how we portray this 10% price wedge. So in the tax group, they're told, you're being taxed 10% on these non-nutritious food. The subsidy group is being told you're getting a 10% subsidy on nutritious food, and the tax subsidy group is being told both of those things. So just to clarify what I mean by that, so the control group and also the people during baseline get 10% off all rated food items And there's no relative price difference created by us between nutritious and non-nutritious food. Everybody in the 3 treatment groups is really getting the same treatment. They're getting nutritious food being made 10% more expensive than non-nutritious food, but the way we frame it differs. So for the first group that we'll call the subsidy group, we tell them you get 5% off everything, but you get an additional 10% off nutritious food, and that's the 10% price wedge. For the tax group, we tell them you get 15% off everything, but we're taxing you 10% on the non-nutritious food, which again creates the 10% price wedge. And then for the third group, we tell them you get 10% off everything, but you get an additional 5% subsidy on nutritious food. You're taxed 5% on non-nutritious food. You combine these two things together, and that's a 10% price wedge. So the only thing that differs for T1, T2, T3 is their perception, or the way we describe it to them. Whether it changes their perception is an open question. So the data come to us from the supermarket chain. They cooperated in this, and so through those scanner cards, kept track of everything people were buying, and they sent it to us. So we know the number of guiding stars. We know exactly what the items were that they bought. We aggregate this data to the household level, and then we aggregate it to the week level. So Monday through Sunday is a week. We drop 2 weeks when we were still notifying people which treatment or control group they were in. We didn't just want to email and text people in case they don't check those, sources. So we had to get the person on the phone live, not a voicemail, and that took 2 weeks. So we dropped those 2 weeks when people were sort of not fully informed. We merge in our survey data, and then the key outcomes that I'm going to describe are expenditures on food in that category, and that's defined before any taxes or subsidies, and then quantities. And so quantities is an imperfect measure because in this grocery data, quantities is no reflection of ounces or volume. And so, for example, 2 half gallons of milk is 2 units, and a gallon of milk is 1 unit. So it doesn't necessarily make sense on a volume basis, but it's what we have for now. So the model in this case is difference in differences, just like it was for the Berkeley situation study. And our key parameter here is beta 0. So that tells us what's the effect of the treatment on the people getting the treatment after the treatment is put in place. We also control for a full set of week indicator variables because the availability of fresh fruits and vegetables varies by week. And then we control for indicator variables by household because households are going to differ in ways that we don't observe. So this is the first kind of model we estimate for quantities and expenditures. And then in the second model, we break out that treatment into whether people were told it was a tax, a subsidy, or both. And so we're able to test whether these people respond equally to the treatment. So here's the basic table of results. So set aside this whole issue of framing that I mentioned before, and this is just showing you what's the effect of the treatment for all treatment groups combined. So this is for the outcome of expenditures, and this is for the outcome of quantities, and it's showing you the treatment effect for different categories of food items. So this is nutritious food, foods that got 1 or more stars, less nutritious foods, foods that got 0 stars. All rated food items are the sum of these 2 categories. Unrated, those are the things that are exempt because they have no calories or nutrients, so that includes bottled water. And then all items is all of those things combined. So you would expect that the treatment by making nutritious food relatively cheaper would increase how much nutritious food you buy and would lower how much non-nutritious food you buy. And so that is technically true according to these point estimates, but these are not statistically significant changes, and economically these are very small amounts. So for example, the treatment effect of making nutritious food 10% cheaper was that people spend on average $1.11 a week more on nutritious food. The effect of making less nutritious food 10% more expensive was that people spent $1.55 less per week. Across all items, the change in total expenditures due to the treatment was just 37 cents, and none of these are statistically significant. The changes, the treatment effects in terms of quantities are pretty similar. They're all small. The only one that's statistically significant is that people bought 2/3 of an item more of unrated items per week as a result of the treatment. So the quick summary is, despite changing prices by a lot, relative prices by a lot, 10%, it looks like there's no statistically significant change in people's behavior. So now we're interested in seeing like, okay, well, what was there an effective framing? So if we tell people it's a tax, does that affect people differently than if we tell them it's a subsidy for nutritious food? So these are the same categories of expenditures. Now I'm just focusing on expenditures, setting aside quantities. And these are the people who were told it was a subsidy. These are the people who were told it was a tax. And these are the people who were told it was a tax and subsidy. And in every case, they're being compared to the control group. And again, you can see that the estimates are not statistically significant, and they're relatively modest in the case of the subsidy group. Some of the point estimates do get bigger, like 450 a week, 640 a week, but still are not statistically significant. And I should caution that, like, at some point when you start splitting the sample enough, you're losing statistical power. Your results are becoming less precise. But again, it doesn't look like, for the sample as a whole, that the framing of this price change mattered a lot for how people, for people's purchases. So one last set of results concerns the role of income. So now we divide the sample into people with a poverty income ratio below 1.3. So 130% of the poverty level is where people qualify for SNAP. It's around where they qualify for Medicaid. So these are the low income people. These are the higher income people. And then again, we're seeing, does the effect of how we frame it matter for people who are low income or high income? And so here's actually where we see something that's kind of interesting, which is the low income people who we tell them they're getting a subsidy, they buy more nutritious food just like you'd think, $11.58 more per week, which is a lot because the average is $28.28, but that's not statistically significant. But what is statistically significant is these same people, even though we're telling them you're getting a subsidy for nutritious food, they bought more of everything. They bought more less nutritious food, $21.23 more. They even bought more unrated foods like, you know, the tea, coffee, water, $5.78. Overall, they spent a lot more per week, $38.59 more per week than the control group. So do we see the same thing for higher income people? And the answer is no. So the higher income people are buying slightly less of these things per week. That's not statistically significant, but it is significantly different than the low income people in the same model. Like these are significant differences by income. These are also significantly different than the low income people told it was a tax or told it was a subsidy. So these low income people that you tell are getting a subsidy are behaving differently from everybody else. And I'll elaborate on why we think that might be in just a bit. So at the end of the study, we didn't tell people when the study would end, because what we were afraid of is if they knew that, they'd go out and buy vast amounts of stuff to get that last 10% off run. So we just ended it abruptly, and then we sent them a survey. And we asked them a variety of questions and asked them to express their level of agreement on a Likert scale. So in other words, the 9-point Likert scale, the 1 to 3 measures, you know, like strong disagreement to moderate disagreement. 4 to 6 measure basically like indifference, and then 7 to 9 measure like how strong is your agreement. And so we asked people, basically, how do you think this treatment affected you? So did you buy more starred foods? So, and everybody, you know, the average answer was in the range of 4 to 5, which is basically that's the range of saying like no strong opinion. And there's not a significant difference between all treatment groups combined and the control group. So the treatment group was, on the point estimate terms, like slightly more likely to agree with that, but it wasn't statistically significant, and it's not very large. Did you buy more non-starred foods that are less healthy? The averages are all in the range of 3, which is disagreement. So people didn't think making, you know, unhealthy food more expensive led them to buy more of it, which is reassuring. Did you buy more healthy food? The level of agreement's in the range of 5. Again, not statistically significant between treatment and control. Did you buy a higher percentage of healthy foods? Again, slightly higher for the treatment than the control, but not statistically significant. So on the whole, it doesn't look like afterwards people thought there was a big impact on their purchases either, which confirms what we're seeing in the objective data. So one other question we wanted to pursue is we just asked them, how did you interpret this price change? And so this should be affected by the frame if you believe that Kahneman Tversky story. So we asked them, you know, did you see this as a penalty for eating unhealthy food? So you'd think the tax group would be more likely to agree with that because that's what we're telling them it is. Even the tax group has an average response of 3.4, which is in the range of disagreement. So even the people we're telling them it's a tax don't see it as a tax. Is it a reward for eating healthy food? High levels of agreement. So the 6s, those are close to an average level of agreement. Was it a tax on unhealthy foods? It's kind of the same thing as number 1, just rephrasing it. Again, everybody's disagreeing with that. So in other words, it seems like these frames didn't really affect people's perceptions very much, which is interesting. And people don't think that the relative price change affected their purchases either. So just to summarize, on the whole, what we find is that despite the fact that we're creating a large price wedge, like a 10% price difference is 2.5 times the average tax on SSBs and snack foods in US states, despite this 10% price change, we don't find a significant impact on what people buy. It's not changing their expenditures on nutritious food or non-nutritious food. So why would that be? So one possibility is that people are relatively habitual, right? They tend to buy the same things week after week. They're not responsive to changes in prices. There may be, you could call them habits or brand preferences, like I only buy regular Coke, I don't buy bottled water. Another possibility, though, is that our particular price change wasn't very salient to them. So the fact maybe that it wasn't right on the supermarket shelf means that it was out of sight, out of mind. People didn't think about it. But we were emailing them weekly, telling them this is how much you're getting in a rebate or subsidies and why. Remember that this is how the prices are affected based on the number of stars and so on. And that USDA Healthy Incentives Plan did see changes in behavior in response to credits being put on people's debit cards, which is exactly what we're doing. As I mentioned, we find no effective framing for the overall sample, but we do find effective framing for the low-income sample. So it looks like low-income people that we tell them they're getting a subsidy buy more of everything, including the thing you're trying to discourage, which is the less nutritious food. So an important caveat, though, is that when we split the sample by income, you're talking about smaller samples and lower statistical power. So why might lower income households buy more of everything? So other research has found that there can be large income effects of price decreases. So that if you're very low income, you don't have a lot of disposable income, changes in prices can make you feel richer, and that would lead you to buy more of everything. And that would certainly be consistent with what we're finding. So in terms of policy implications, it looks like to change people's behavior, to get people to consume more nutritious food and to buy more nutritious food and less non-nutritious food, taxes would have to be large. Again, this 10% price difference didn't have a significant impact, even though it was 2.5 times the average tax of its kind in the US. The other interesting thing that should be kept in mind is that we're finding this evidence of an income effect for low-income groups, that by subsidizing nutritious food, you may have this unintended consequence of those people buying even more non-nutritious food. And then finally, one important thing to point out is that even if these taxes don't really change behavior, they still can be useful from an economic perspective because they are internalizing those external costs that I started out talking about, and they can raise revenue, right? So every government needs to have revenue for its operations. This might be a really efficient way of doing it if people's choices aren't really influenced by the amount of the tax. So that concludes my prepared remarks. If you want any more information, please feel free to email me, and I look forward to hearing your thoughts on all this.
Questions. I think I missed the information on the types of food stores you were looking at in the Berkeley study.
Yep.
Was it just supermarkets?
Oh, thanks for bringing this up. I think I missed that. Yep, so it's grocery stores, supermarkets, convenience stores, both freestanding and attached to a gas station. Okay. Now, one we didn't go to was liquor stores. The other study went to them. And one that we weren't able to get data from are stores that didn't have posted prices.
Didn't have what?
Posted prices. And so in low-income neighborhoods, there are these stores where, basically you take your stuff up, they bring it up, but it's not listed. But the other study did collect data from them. So, and the results tend to agree. But thanks for raising that.
Yeah, and then the second question is about the other study. Do you have household level health data on those families? Because one thing I would wonder about is purchasing decisions, the assumption that people are going to use a label, and then if they do, what's the incentive or the motivation for them to do that? And if you have households where there is already somebody in the household who has a diet-related health condition, would they be more likely to
be responsive?
Yeah, it's just from what we know about health changes, behavior changes in health when people have diet-related conditions. So I was just curious if you had looked at that analysis or had the capacity to do that.
Yeah, so this is a great point. So we haven't done that yet, and I will definitely go back and check that survey to make sure to see if there is something in there about like health consciousness or I'm pretty sure we asked people about like how frequently before the study they read labels and things like that. So we could use that as a minimum or.
Yeah, we had a supermarket study here. We did, and one of the questions we asked people is do you or anyone in your household have any of the following diet-related conditions?
Yeah.
As sort of a trigger to figure out, were they more predisposed to thinking about buying healthier food choices if there was someone who already had a condition?
Yep.
That may then ripple effect into the rest of the household purchasing and cooking and whatever.
Yep, great point. Yeah.
Any other questions?
You have to power the mic on it. It's on the bottom.
Looks good anyway.
Anyway,
Yeah, my name is Jocelyn Dunstan. I'm a postdoc in the Global Obesity Prevention Center. And I was wondering when you compare San Francisco with Berkeley, and you said like, oh, there might be some like cross-border shopping. What about like if the shop in San Francisco was overall cheaper? Like, did you account for that? Did you check that maybe it wasn't about just the soda, it was cheaper to go to San Francisco to buy things? Like,
So we didn't survey any individuals. All the data is at the store level. So we don't have any interviews with people about like the extent to which they shop. So we know from other sources, like Nielsen data. So there's a version of the Nielsen data that's where you know the stores they were buying these things at. And so it's been calculated that the average like American drives like 4 or 5 miles to shop at a supermarket. And so that's definitely consistent with people in Berkeley going elsewhere to shop. We don't know, we have no separate information as to where they're shopping. And I guess by showing you that map, we're kind of inferring that if they're going to cross-border shop, they'd go to those nearby communities where we're showing these stores. That's not San Francisco, but it could be even farther. So yeah, so unfortunately I can't say where they might be doing this.
In other words, being controlled by other food items in San Francisco and Berkeley to compare like that, something nothing to do with the tax, like, I don't know, rice. The same brand was the same price in both places?
So we do have these untaxed drinks. So we have like Dasani water, we have diet versions of the sodas and things like that. And I didn't talk about that as a counterfactual today, but we do have other results on that. But the other thing is that with the difference in difference model, you have data from the same stores both before and after. And the difference in difference model basically knocks out all the time invariant characteristics of those stores. And so the nice thing is, like, if people do behave differently in a different kind of neighborhood, or different patrons at different stores, are differently responsive, and that means a different level of pass-through, like anything time invariance dropping out of the model and not biasing anything.
Yeah. One really impressive data collection. Oh, Matt. Hey, John. John was one of my advisors at undergrad, so I've known him a long time. So a really impressive data collection. And one thing that I was hoping you might show on the map, maybe you've already looked at this, is overlay the BART train on top of that map.
So overlay the what?
The BART train on top of that map.
Oh, okay.
So you can see, one thing I'd be interested to see is distance to the BART stop, because that's something where you might observe an effect for those 20-ounce drinks of people going to work, willing to wait until they got to San Francisco. And if you're really close to a BART stop, you're not going to pass through.
Yeah, it's a great suggestion. I think that would be easy to do.
Yeah, that would be super easy to do. I don't know if you'll find anything for it, though.
Cool.
I think you were waiting.
Rajiv Sherkupalli. I work primarily on tobacco, so there are a lot of analogies.
Yeah.
I guess I had a question on more pertaining to the incomplete pass-through and that sort of literature. So basically, pass-through ends up being an empirical question, and in this case, it's less than complete pass-through. But this was a tax that was collected from the distributor, so which means that the distributor is returning 1 cent to the government, no matter what.
Yep. And
the distributor is passing less than that tax to the final consumer. Does it say something about designing these taxes? So if I, as government, wanted to make sure that one tax hit and it was salient, do you want that to show up in a different way?
Yeah, so the sort of theoretical public finance answer is that it doesn't matter whether you levied on the person or the store or the distributor. The relative elasticities of supply and demand are what's going to determine who actually pays it. But, I mean, one thing that I think does come out of this is you might want to think about different tax amounts on different sizes. And so if you think that, pass-through is particularly high for 20 ounces and particularly low for larger sizes, you could have different tax, it could be 1 cent per ounce for 20-ounce bottles, and it could be 2 cents per ounce for 2 liters and cases. Like, if what you're trying to reverse engineer is a certain price increase for consumers, you can, just set the rates differently to end up with that. So that's one possibility.
Hi, my name is Anna Karmatz, and I did my undergrad and master's at Cornell. So it's
right.
wonderful to see a Cornell
Outstanding.
professor here. One of the questions I wanted to ask is, can you talk a little bit more about the framing finding? I was a little surprised that participants did not see, there was no framing effect. And I know that researchers some of your colleagues have, like Dr. Valerie Reina and
Yeah.
Dr. Wonsing have done a lot of work on kind of framing and people's understanding of food choices as well. So what are some of the findings that maybe were not done in a store setting?
From what other contexts do we think frames matter?
Yeah, and kind of what do you think about why there were no results in this case? And do you expect that other studies might find results or not?
Yeah, so it's an interesting question. Yeah, I guess one thing that's important to clarify is just because people didn't end up with different perceptions of the treatment because of what we told them, it doesn't mean there wasn't some other way to explain it that would have led to differences. It's like saying, well, advertising doesn't work because that poster I made didn't increase sales, right? Like, well, maybe somebody else should make a better poster or something like that. And where I think this is particularly relevant nowadays is with the ACA, employers have more latitude to have wellness programs that offer carrots and sticks to their employees. And there seems to be this debate of like, what's more effective? And would you be more motivated if I told you that you could save 10% on your health insurance premiums if you quit smoking? Or what if I instead make it a stick and say, I'm going to raise your health insurance premiums by 10%? And so the framing, I think, is really important in those kinds of contexts. And it's like sort of a new frontier because the ACA really expanded employers' options in that area. So to me, like, this is a neat area for future research.
Okay, we have time for basically one short question, but John will be around afterwards. So, Lauren.
Hi, I'm Lauren Nicholas in Health Policy and Management, and I guess building on what Rajiv was asking, I didn't know if you guys have enough data or could in the future look a little bit more at incidents. I know nothing about how the different distributors negotiate with stores and things, but are prices differentially passed on in like corner stores versus supermarkets?
Yes, so we did, we don't have enough, like there aren't that many like large supermarkets in Berkeley to have to estimate models for them
I guess
alone.
everything is a food co-op, and this is a bad place to look.
So we took them out. So at least like we were able to look separately at like all convenience stores or separately at all stores that are not part of a chain, that are independent. And there was no significant difference between the main results in those. So yeah, it doesn't look like there's that kind of heterogeneity in there. Yeah. And the distributors are something we would love to gotten more data on, but they would not respond. We could not crack that nut. So if anybody here has family who work in the SSB distribution business in Berkeley, please let me know.
Okay. Well, obviously your talk has generated lots of questions and lots of interest. This is such a timely topic, and certainly maybe if there are any lingering questions, we'll have a little bit of time to answer them afterwards.
Absolutely.
But we'd like to thank you again for joining us at the Global Obesity Prevention Center and for a wonderful talk. And thanks again.
Thank you. Thanks, everybody.